Hello, my name is Co Mai Duong. I am a Pharmacist Candidate of 2022 from California North State University, College of Pharmacy. Today, I'm going to introduce one of a psychiatric medication named Risperidone. On the slide here, we have all the formulation of Risperidone in US, from capsule to tablet to suspension. Risperdal cont'd is the IM formula. Precaution is the sub-Q formula, and on the bottom right, last but not least, is the ODT formula. Some patient consult point. What this drug used for? It is used to treat the schizophrenia. It is used to treat bipolar problem, and it is used to treat the irritated aesthetic disorder. What do I tell my doctor before to take these drugs? If you have any allergic to this drug or any part of these drugs, or any allergic reaction to other drugs, food, or substances, tell your doctor about the allergy and what the sign you have. What are some side effects that I need to call my doctor right away? Sign of allergic reaction such as rash, hive, itchy, red, swollen, blistered or peeling of skin. Sign of high blood pressure such as confusion, feeling sleepy, more thirst, more hungry, passing out more urine, very bad dizziness or passing out, change in how you act, mood change, shakiness, trouble moving around, or stiffness. And what are some side effects of these drugs? For all the products, weight gain, restlessness, feeling dizziness, feeling sleepy, tired or weak, anxiety, constipation, diarrhea, stomach pain, and throw up, heartburn, dry mouth, and more hungry, and some nose irritation, headache, trouble sleeping, back pain, and muscle pain. And for the injection, the irritate where the shot be given. So for the indication of the Risperidone, it is one is to treat bipolar disorder from the age of 10 to 17, to treat the schizophrenia from the age of 13 to 17. Irritability associated with aesthetic disorder is the age of 5 to 16 years old, and to treat the aggression, deliberation, self-injury, and temper tantrum. So what are the mechanism of Risperidone? Risperidone is one of the antipsychotic agent. It is second generation or atypical. Risperidone bind and inhibit at the following receptor with the different potency. D2 is very high, and 5-HT2A is high potency. Alpha 2, alpha 1, and H1 is moderate. So what are some interaction? Risperidone is substrate of CYP2D6, CYP3A4, and PG glycoprotein. Some food interaction. Oral solution is not compatible with beverage containing tannin such as tea or cola. How to manage it? So take oral solution with water, coffee, orange, or low-fat milk. Some pros and cons. Pros: many formulation, low cost, low risk of increased prolactin and breast discharge, and per series there's no oral risperidone overlap. For some cons, it's a high risk of EPS, especially with akathisia, moderate risk of weight gain. It has some anticholinergic side effects, especially with elderly. For the Risperdal consta, it is required 3 weeks of oral risperidone overlap. Dosing and administration for the long-acting IM or Risperdal consta, the indication is a bipolar disorder and schizophrenia. Dose from 25 to 50 IM every 2 weeks. The first injection need oral risperidone for 3 weeks. For Perseris, indication is for schizophrenia. The dose is every month. No oral risperidone needed. It's sub-Q in the abdomen only, and when you inject it in a supine position. For oral formulation, it's a tablet, ODT, liquid. Indication is for bipolar, mania, autistic disorder, schizophrenia. For oral and ODT, the strength from 0.25, 0.5, 1, 2, 3, 4 milligram tablet. Liquid is 1 milligram per ml, and the dose for these indications are from 4 to 60 milligram day. Start with 1 milligram BID. Some other common side effects: risperidone can be activating or sedating side effects, angioedema, dyslipidemia, extrapyramidal syndrome, hematologic abnormality, hyperglycemia, hyperprolactinemia. The black box warning for risperidone is the increased mortality in elderly who are dementia. Neuroleptic Meconium syndrome, orthostatic hypotension, QT prolongation, sexual dysfunction, temperature dysregulation, weight gain, and mortality in older people, as I mentioned in the black box warning. Some warning and precaution. Some concern with side effect, anticholinergic side effect, suicidal ideation, diseases related concern with cardiovascular disease, hepatic impairment, renal impairment, and seizure. For dosage form specific, Perseris contain benzoyl alcohol, dispersible tablet, and sub-Q injection site reaction. Some monitor parameter for efficacy: A1C at baseline, repeat 3 months after starting, and then yearly. CBC monitor frequently until the first few months of therapy. Fasting lipid panel at baseline, repeat 3 months after initiating. Blood pressure at baseline, repeat 3 months after initiating, and then yearly. For safety, mental status alert, weight, height, BMI, waist circumference, electrolyte and renal liver function, change in menstruation, libido, abnormal involuntary movement or Parkinson's site, autonomic instability. Some dosage adjustment for renal: oral if the creatinine clearance less than 60 mg per minute, initiate dose of 1 mg. If the creatinine less than 30, initiate 0.5 mg BID, titrate slowly. For IM, initiate with oral dosing, and if tolerate, can begin 25 mg IM every 2 weeks. For sub-Q, there's no study. For hepatic, oral is if it's mild to moderate liver impairment or tau PUC class A or B, no adjustment needed. For severe impairment or tau PUC class C, initiate 0.5 mg twice daily and titrate slowly. For IM, as a renal adjustment, and for sub-Q, there's no study. And here's my references. Thank you.